CPR.
We're also going to be going over the different types of situations which can vary depending on the victim.
All right, let's get started. You perform CPR when a person does not have a pulse and is not breathing. But before you can actually perform CPR, you must first assess the situation and survey the scene and make sure it is safe. If the scene is safe, you then want to approach the victim and see if they're okay. You do this by tapping the victim on their shoulder and asking if they're okay. If they're not responding and they're not conscious, you then want to call 911 immediately.
Quick tip! When you call 911, make sure you single out one person to call and get back to you. Louie, call 911 and get back to me.
You got it.
Quick tip 2. When the scene is not safe, you need to make it safe. This is by either moving the victim to a new area or moving anything that could pose a threat to you or the victim. Make your own judgment call when deciding if the scene is safe or not.
After 911 has been called, you then want to perform a primary assessment. You want to check to see if the person is breathing and to see if they have a pulse. You want to check for a pulse for no more than 10 seconds, and at the same time, look to see if the person's chest is clearly rising and falling. If you forget and need help on how to check for a person's pulse, look back at our rescue video.
Remember, if the victim is bleeding, remember to observe the law of universal precautions and glove up. Remember, if the person has a pulse but isn't breathing, you're going to do rescue breathing. But if the person doesn't have a pulse and isn't breathing, you're going to do CPR. You continue CPR until the following things happen. 1. An EMS arrives. 2. An AED becomes available. 3. Someone with a higher certification comes. 4. You are physically incapable of doing CPR anymore, meaning you will pass out if you go any longer. Or 5. You see an obvious sign of life. These are the only times or circumstances that you can stop CPR.
Let's go into CPR situation 1. This is an adult, 1 rescuer CPR. The compression to breath ratio for adult 1 rescuer CPR is 30 to 2. This means 30 compressions, 2 breaths. Now let's go demonstrate. $20, $30. When you guys are doing compressions, make sure that your hands, palm of your hand is lined up between the victim's nipple line, right here. And then when you do compressions, make sure your wrist, elbow, and shoulder are all in line. This helps you use your body weight when you do chest compressions. You don't want to be there doing tricep dips. You want to use your body weight. It helps you become less tired as you do compressions. I'll show you a few. And when you're doing compressions, also make sure that your knees and your body are directly parallel to the victim. And make sure when you're doing compressions that their one arm is up on the side of your compressions. When you're doing rescue breaths, you want to make sure that the mask is covering the victim's nose and mouth, and your thumbs run parallel on top of the mask. This helps create an airtight seal. And remember, do not forget to tilt the airway and open the airway. This will give you the best possible outcome to getting air into the victim's lungs. I'll show you.
Now we're going to move on to situation 1B. This is adult 2 rescuer CPR. There's only one difference here. One person is going to be behind the head giving breaths, while the other person is on the side giving compressions.
The reason why one guard is positioned behind the head is because that position allows that guard to get the best possible open airway. And it also alleviates the problem. If the person pukes, you need to roll the person on the side. And so you roll the person on the side to where there is no guard position. This prevents either of you from being puked on, thus observing the law of universal precautions. 1, 10, 20, 30. The switch. The switch is used when you're doing 2 rescuer CPR and one guard gets tired. That's most likely the guard doing the compressions. How this works is the guard giving compressions tells the guard giving breaths, hey, I'm tired, we're switching after this round. So the guard finishes his or her 30 compressions, then that guard gives 2 breaths. while that guard is giving 2 breaths. The guard from the head comes to the other side in a rescue ready position to give compressions, while the other guard moves to the top of the head. I'm gonna switch.
Okay.
10, 20, 30. Breath, breath.
10, 20, 30.
Breath, breath.
Now we're moving on to situation 2, which is child CPR. The compression to breath ratio for a single rescue or child CPR is 30:2. This is the same thing as adult CPR, except the difference here is how you give the compressions and the breaths depending on the size of the child. When giving breaths on a child, you would give a half a breath what you would normally give an adult to see the chest clearly rise and fall. Giving compressions on a child within the smaller size, you want to use one arm. This is because it takes less force to compress their chest. When doing CPR on a larger child, you want to give compressions and breaths the same way as you would on an adult.
Tip 3. To determine between a child and an adult, you want to look for signs of puberty, like chest hair on guys, breast development on girls, and you would also want to look at the size of the child. If the child is smaller, you would want to treat it as a child. If the person is larger, treat it as an adult.
Now we're going to move on to situation 2B, which is child to rescuer CPR. The compression to breath ratio is 15 compressions to 2 breaths.
1, 5, 10, 15.
Remember, everything else stays the same for child to rescuer CPR except the compression to breath ratio.
The next situation we're going to go over is situation 3, and that is single rescuer infant CPR. Now this is different from all the other ones that we've done in the past, but let's walk through it. The compression to breath ratio for a single rescuer CPR for an infant is 30 compressions, 2 breaths. And you would give compressions with 2 fingers. The reason why you give compressions with 2 fingers is because the amount of force needed is much less compared to a child, and especially an adult when giving compressions. 1, 10, 20, 30. Breath, breath. Just a quick reminder, guys. Remember when you're giving breaths to an infant that they are more like blowing out a candle, more like puffs, because if you blow too much air into an infant, it can get into their stomach and cause them to puke. Just remember that.
The final situation is situation 3B, which is to rescuer infant CPR. The compression to breath ratio for to rescue infant CPR is 15:2. The compressions for to rescuer infant CPR are done using reverse grip. This is when you place your thumbs directly on the infant's chest and use your other fingers to wrap around its body. 5, 10, 15.
Breath, breath. All right, guys, just for a final review, remember, single rescue CPR, the compression to breath ratio never changes. It's 30 compressions, 2 breaths. The only time it ever changes is when you're doing 2 rescue CPR for a child and an infant. And that's 15 compressions, 2 breaths.
Also remember that you only give CPR when the person has no pulse and isn't breathing.
One more thing. The only time you would ever stop CPR is when EMS arrives and AED becomes available. The scene becomes unsafe. You become too physically exhausted to continue. A person of a higher authority, like a doctor, comes to the scene, and if you show signs of life.
Alright guys, that was CPR. If you have questions about any of this, you can call your supervisor, talk to your manager, or even call the office.
Alright guys, we'll see you